Good afternoon. Please welcome the president of the Theta Mu Omega chapter of Alpha Kappa Alpha Sorority Incorporated, Dr. Tangela Alford Gentles.
Good afternoon, everyone. Again, I am Dr. Tangela Alford Gentles, president of the Theta Mu Omega chapter of Alpha Kappa Alpha Sorority Incorporated. Thank you all for being here with us today. We're so pleased that you are here. Today marks the third webinar of our three-part series. Before we get started, I would like to express my sincere appreciation to all of you who generously helped to make this event come together. Dr. Samira Bowen and her committee members, we could not have done this without you. To all the panelists, we thank you for your time and your professionalism. COVID vaccines. Maybe you have seen information on social media, heard about it from a friend or relative, got information in an email, or just been wondering silently to yourself about the vaccinations. No matter where you heard about the COVID-19 vaccines, you may be a bit weary about getting vaccinated when it's your turn. Or maybe you're pretty sure you will get the vaccine, but you need some plain English explanation as to why you should do so. Our panelists today have collected some of the most widespread rumors, claims, myths, and worries about the COVID vaccines, and we'll discuss some of them today. The experts will provide scientific information to help you make an informed decision. What we know. Studies show that COVID-19 vaccines are effective at keeping you from getting COVID-19. Experts also share that getting a vaccine may help you from getting seriously ill if you do not get the virus. What we do know is that COVID vaccines are effective at keeping you from getting sick. Scientists are still learning how well vaccines prevent you from spreading the virus to others, even if you do not get sick. Some of you also may be wondering if the COVID-19 vaccines are safe. Our panelists today will also address the safety of the vaccines. Again, our panel of experts will provide scientific information that will assist you with making a decision for yourself. We encourage you to talk to your primary care physician and review the resources from today's webinar. Theta Mu Omega will continue to provide science-based, unbiased information so that you can make an informed decision. So again, a very warm welcome to each and every one of you, and thank you for spending your afternoon with us.
Thank you, Dr. Alford. Please welcome Akeisha Jackson, who will introduce our moderator for today.
Good afternoon. I'm Akeisha Jackson, a member of Alpha Kappa Alpha Sorority Incorporated and the Omicron Eta Omega chapter in St. Louis, Missouri. It is my honor to introduce our moderator for today's session, Crystal D. Crawford, a seasoned leader with more than 20 years of senior management experience in the legal, philanthropic, and nonprofit sectors. Crawford has played a pivotal role in advancing the health and economic security of low-income Californians, women of color, and communities of color. Crawford is active in the leadership of numerous civic and community organizations. She sits on the 5-member Los Angeles County Public Health Commission. She also serves on the boards of the Black Alumni of Dartmouth Association, the Black Women Lawyers Association of Los Angeles Foundation, and Funders Concerned About AIDS. Originally from Harlem, New York, and Teaneck, New Jersey, Crawford earned her bachelor's degree in history from Dartmouth College and a law degree from the New York University School of Law, where she was chairperson of the Black Allied Law Student Association and served on the editorial staff of the Journal of International Law and Politics. She is admitted to the bar in California, New York, and New Jersey. I am pleased to welcome Crystal D. Crawford.
Thank you so much for that generous welcome, Sora Akeisha. I am so very glad to be with you all today, moderating this important discussion. And I just want to make sure that everybody knows that we are family here today. So I say good afternoon, family. And I too am a proud member of Alpha Kappa Alpha Sorority, and I'm grateful to the Theta Mu Omega chapter for inviting me to be your moderator today. We've got a lot of exciting features to today's program. First of all, we've got a poll that we'll be doing to ask you a question. We'll be asking you a poll at the beginning, a poll at the end, see if your insights and thoughts about this issue have changed. In addition, we will be hearing from a variety of experts in a panel setting, a discussion, as well as kicking off with a presentation from a physician who will provide us important information. So it's going to be a varied afternoon. So glad to be with you, and really, really give all of you major kudos for taking out time to discuss this important issue. It is a life and death matter, and we all need to take it very seriously, for it is a serious matter. I would like to kick off the poll. Will you put the poll up for me, tech person, so that we can have folks. The question we're asking you today is, are you going to take the vaccine? Yes, no, or maybe. So if you would please chime in and give us your answer to that poll, and then we will provide you with the responses before we move on to our first presentation. Yes, no, or maybe, are you going to take the vaccine? Okay, hopefully you have had a moment to submit your answers, and we will get the responses shortly. In the meanwhile, I want to just say that, you know, as a public health commissioner, as a person committed to physical, mental, and emotional health, this is a time where we have to prioritize our health and wellness and our family's health and wellness. It is not a time for making your health and wellness secondary or tertiary on your list. It's got to be primary, your own personal health and wellness, as well as your health and wellness of your loved ones. So let's all commit today to making sure that we are prioritizing our wellness, physical, mental, and emotional wellness. All of those components are important. And for those of you who are people of faith like me, your spiritual wellness as well. Do we have the responses from the poll ready? Okay, 73% rather of folks say yes, 8% no, and about 19% of you all are on the fence. Okay, all right. Well, we'll see. Hopefully, at the end of this discussion, you'll get some information that'll help you firm up your decision, or maybe even change your mind about what might be best for you and your family. I sit on the COVID-19 vaccine task force on the state level, and one of the things we found in our polling is that it's very important to lift up that we are making decisions not just for ourselves, but for our family. So as you think about how you're going to treat this issue of the vaccine, you know, there are a lot of considerations, and our panel today and our presenter today will help give you some information to be informed about making that decision, and making one that's informed and making the one that's best for you. Just want to remind folks before I introduce our first speaker, Dr. Davis, that this presentation and this event today is for informational purposes only. Really important that we make that very clear. So I am going to introduce our first speaker, who will be presenting to us for about 10 minutes. Dr. Jean Davis has decades of experience as a community advocate, educator, clinician, and researcher. Her extensive education includes a BA in psychobiology, a BS in human biology, and an MS in clinical research, as well as a doctoral degree in chiropractic medicine and a PhD in preventative medicine. She's an associate professor of internal medicine at Charles Drew University of Medicine and Science, past medical director and HIV clinician at AIDS Health Foundation and the Desert AIDS Project. Dr. Davis is the Black, Indigenous, and People of Color Task Force co-chair. She is a member of the Links Incorporated Beverly Hills West chapter, and a proud member of Alpha Kappa Alpha Sorority Incorporated. Her continued focus is on total health and the reduction of disorders and diseases which disproportionately impact underserved communities and related social determinants. These health disparities include HIV/AIDS, cancer, heart disease, substance abuse, diabetes, and kidney disease. We will now hear from Dr. Jean Davis.
Hello, and thank you so much. We will start my slides in just a moment. Next slide. when we see HIV, when we look at COVID-19 and we see things on TV, we see the happiness and the joy of the gentleman playing a violin while his neighbor across the walkway is listening, the neighbor below she's videotaping and just wanted to send it to all of her friends. And then the neighbor across from her is on a computer, just happy to be on Zoom. But when you look below that, you see the chaos that really is going on with COVID-19. The reality of COVID-19 is that there was extreme high rate in correctional facilities. The reality of COVID-19 is that there were 7,000 deaths associated with nursing homes. About 1/5 of all the deaths after the first COVID death was actually associated with nursing homes. It disproportionately impacted Native Americans, it disproportionately impacted Latinos, and it disproportionately impacted us. When we talk about health disparities, we know the health disparities are preventable. And the health disparities, when something that's preventable actually has a burden or disorder on other people that are disproportionately impacted, and they don't have the opportunity to achieve optimal health. The health of communities of color is an environmental problem standing on the pedestals of racism. It is a system level problem that is based on the lack of appropriate societal resources, as well as health promotion and disease prevention, which within healthcare systems, misinformation, the lack of healthcare access, the lack of utilization of healthcare, the lack of health promotion transfer, leading to health practices that are poor and poor outcomes. Is COVID-19 a health disparity? Well, first of all, let's look at the stats on COVID-19 and see what areas are most disproportionately impacted. So we see California is leading, followed by Texas, Florida, New York City, followed by Pennsylvania, New York, and then New Jersey. Now let's look at how it impacts based upon gender. So when we look at the difference between male and female, when we look at the area where they're 85 years and over, we see that men have the largest death rate. But from 75 to 84, all the way down to under 1, it's women who have it's just the opposite. Did I do it right? Yeah, it's women that have the highest rate in 85 and over, but under that, it's men who actually have the higher rate. Health equity. So what is health equity? Health equity means that everybody has the opportunity to be as healthy as possible. Equitable opportunities include equal access to and distribution of resources. Achieving equity requires addressing needs due to long-term disinvestments which need to be caught up. When policies, programs, and systems that support health are equitable, poor health outcomes can be reduced, health equities can be prevented, and the whole society will benefit. So let's look at the making of a disparity. So when we talk about health disparities and COVID-19 at this point, we look at the reasons that health disparities occurred with COVID-19 is because people of color, Blacks, we actually have an increased exposure based upon our jobs, poor housing conditions, and the utilization of public transportation. We also have a higher rate of chronic diseases such as diabetes, chronic kidney disease, hypertension, cardiovascular disease, asthma, and COPD. In addition to that, we have lack of access to quality care. We did not have early testing, there was poor preventive care, and then there was poor hospital care. That's all based upon, once again, structural racism. Every system is perfectly designed to achieve the results it gets. Next. So when we look at COVID-19, which is our latest health disparity, Blacks are disproportionately affected by COVID-19. Conditions in places where people live, learn, work, play, worship, affect the wide range of health risk outcomes, such as COVID-19, serious illnesses, and death. These conditions are known as social determinants, long-standing inequalities that impact our health, included but not limited to low income, education, housing, criminal justice system, employment, and healthcare access. All of these are interrelated and influence a wide range of health and quality of outcome risks. So now let's look at how COVID-19 is disproportionately impacted compared from white to Black. So when we look at the cases, there's only 1.1 times the number of cases in Blacks versus whites. So the cases are not that much different. But when you look at the hospitalization, we have almost 3 times the hospitalizations that whites have. And then we have almost 2 times the number of deaths that whites have. So let's look at this based upon death rates by age and race. So orange, and Latino, Hispanics are gray. So when you look at the age group from 85 and over, you see it's much higher in the Black population. When you go from 75 to 84, still higher. 65 to 74, still higher. 55 to 64, higher. And 45 to 54, higher. And those within the age group of 35 to 44, death rate is also higher. So across the age spectrum, Blacks are dying more of COVID-19 than any other population. So when we talk about the leading areas of racial health disparities associated with death, the leading cause today is COVID-19. COVID-19 is leading cardiovascular disease, diabetes, infant mortality, cancer, and HIV/AIDS. So long-term risk of COVID-19. We're still investigating this, but if you look at the lower area where the young man from Florida, he had a problem with his heart associated with COVID-19. When you look over to your right, you can see there are things called long haulers contagious. So we really don't have a lot of information on that, but we don't know how being a long hauler is going to actually impact your health down the road. But the major problems with COVID-19 is the long-term symptoms, which include difficulty with concentration, depression, muscle spasms, headaches, your heart beating fast. Most serious ones include cardiovascular problems, breathing problems, kidney problems, skin rashes, neurological problems, and also psychiatric problems. A study was recently done during what they called a post-recovery check, and they found that patients now have post-traumatic stress syndrome associated with COVID-19. So what's the benefits of getting the vaccine? Vaccines protect you and your family and your community from symptomatic COVID-19. Pfizer and Moderna are 95% effective. The new vaccine that just came out, Johnson & Johnson, is 66% effective, but they've shown in certain regions it's actually 85% effective. We'll talk about that later on. The annual flu vaccine is usually between 40 and 60% effective. The vaccine reduces the chances of hospitalization. Being unvaccinated will increase your risk of getting COVID-19 and also having serious long-term complications, including hospitalization associated with COVID-19. So let's weigh the differences between infection and vaccine. So out of every million COVID vaccine infections, there are 19 infections, there are 1,500 deaths, 70,000 hospitalizations. On the other hand, every million COVID-19 vaccinations, those who get vaccines, have 2 to 3 serious reactions, which can be anaphylaxis shock. And what that means is that you have a severe allergic reaction and they give you some medication to stop the reaction, you're okay. The reaction usually only starts 30 minutes after you get the vaccination. So if you have a history of severe allergies, you should let your healthcare provider know and they'll take it from there. And 1 to 2 hospitalizations and 1 to 2 deaths are under investigation. I know some of you heard people dying after they get a vaccine, but that's an association, it's not necessarily a causation. It's something that happened, but it doesn't mean that it was caused by the vaccine. But there are 1 or 2 that it's under an investigation right now to make sure that COVID-19 was not the cause. Next. So which vaccine is better? So when we look at Moderna and we look at Pfizer, we see there's very little difference. And the most important thing about this is that it doesn't matter which vaccine that you get as long as you get the vaccine. Now, when you look at Johnson & Johnson, Johnson & Johnson's a little different from Pfizer and Moderna. Pfizer, Moderna, and they'll talk about this later, has a different transport system, which is called a messenger RNA. And with that transport system, the word RNA and DNA kind of go together. So people think that if you get this vaccine, you're going to end up with problems going into your RNA, going into your DNA. But it does not go inside the nucleus where the DNA is actually replicated. But with the Johnson & Johnson, it's the old school type of vaccine. So it's not with messenger RNA. So that may be more comfortable with people who are concerned about messenger RNA. Next. So when we look at the side effects, now here we start off with the dosage. Pfizer, Moderna, both you need 2 shots. And Pfizer's 28 days apart, 21 days apart, Moderna's 28. They're both about the same effectiveness. Pfizer is 95% and Moderna is 94.1. But when you look at Johnson & Johnson, there's only 1 shot. And as I said before, even though in clinical trials it's 66% effective, but it's shown when they did the studies in the real world, it was about 86% effective. And also, Johnson & Johnson did their trials during the period of time where we had the variants coming out. So whereas Moderna and Pfizer did not have these variants as we have now. So people were saying maybe Johnson & Johnson may be better, we don't know. And we may need to have a second shot with Johnson & Johnson, maybe in addition to having a 3rd shot from Pfizer and Moderna. So side effects, chills, fever, joint pain, muscle aches, fatigue, pain at the injection site, and headaches. And these things usually go away within 7 days. Sometimes it lasts up to 14. But if I had to have these lists of things versus having COVID-19, I'll take that for 14 days. Next. So remember, with all of this information, we still need to wash our hands, wear a face mask, and stay 6 feet away from each other. Thank you.
Thank you, Dr. Davis. That was outstanding. Thank you for such comprehensive and information and presented so very well. Thank you. We are going to now move into hearing from our panelists. So I am going to introduce our panelists, and then there's going to be a question that they all will answer. I will tell you what that is yet. I'll first dive into introducing our panelists. The first panelist I'll introduce is Dr. Lashay Ajayi. Dr. Lashay Ajayi is a fellowship-trained palliative care physician and pediatrician. She's currently the Director of Clinical Research and Diversity Initiatives at Scripps Research Translational Institute, as well as an assistant professor of pediatrics at UC San Diego and Rady Children's Hospital, where she works as a community hospitalist and pediatric palliative medicine physician. She's a member of the Pediatric Operations Task Force and the Digital Health Technologies Committee of the All of Us Research Program with the National Institutes of Health. Dr. Ajayi is part of our team today, and we are so very happy to have her with us. Our next panelist is Dr. Eric Bonner. Dr. Eric Bonner is an internal medicine physician at Vidant in Edenton, North Carolina. He works at the Brody School of Medicine as an assistant professor of internal medicine and as a hospitalist at Vidant Chowan Hospital, where he currently serves as the medical director for ambulatory quality and patient safety, as well as a director for continuing medical education. In his practice, he continues to teach students and residents from North Carolina's medical, nursing, and physician assistant schools. He credits an incredible family and a loving, supportive church family as the foundation for his success. We are so happy to have you, Dr. Eric Bonner. Our next panelist is Dr. Ronald Jefferson, who was born in Pine Bluff, Arkansas. Dr. Jefferson received his bachelor's degree in zoology from Michigan State University. He obtained his medical degree from the University of Michigan Medical School, where he also completed his internship and residency in internal medicine. Dr. Jeff, as he is known, is board certified in internal medicine, and he has been practicing medicine for decades. For over 30 years, he's taken care of patients with HIV and Hep C at the Oasis Clinic in Los Angeles, which is an affiliate of Charles Drew University. He is well respected in our community, and we are so fortunate to have him with us today. Thank you for joining us, Dr. Jefferson. The next doctor that will be joining us as a panelist is Dr. Freeman. Dr. C. Freeman is a practicing adult and geriatric psychiatrist whose commitment is to create healthier lives through delivering healthcare of the highest quality and providing mental health education to the community. Dr. Freeman is a graduate of Howard University. She completed dual internal medicine and psychiatry residencies at the University of Virginia. She is nationally known as a medical leader, elder abuse expert, educator, and healthcare administrator. She is gem and jewel to our community, and we are so very happy to have her with us today. Dr. Freeman, and the very last panelist that will be joining us is Dr. Ogandinma Obi, also called Dr. Oga as a nickname. She's a native Texan, born and raised in Houston, who graduated cum laude from University of Houston with a bachelor's in biochemical and biophysical sciences and a minor in chemistry. She received her doctorate in medicine from University of Texas Medical Branch in Galveston. There she received an honors designation for her research in burn surgery. She completed her residency in emergency medicine at the University of Alabama at Birmingham, and in 2012, she served as the department's first Black female chief resident. Go ahead, Dr. Oga. We are so fortunate to have you with us also, Dr. Oga. And I am going to dive right into the question of the hour, which is, have you taken the vaccine or are you going to take the vaccine? Why or why not? We want to know what your thinking is that can help inform our thinking for ourselves and our family. So the first person who I'm going to ask to answer that question is Dr. Freeman. Dr. Freeman, have you taken the vaccine or are you going to take it? Why or why not?
First, I want to thank you for having me participate in such a distinguished panel. And I, as well as my 100-year-old mother, have both taken the vaccine. Now, initially, I had no intention of taking it. Like others, I was suspicious. I'm a scientist and I believe in the science. But the American medical system hasn't been particularly trustworthy when it comes to the treatment of Black, Indigenous people of color. And so I was willing to wait. During the pandemic, I lost my father 3 weeks shy of his 101st birthday. Now, the coronavirus did not rob him of his life, but it did rob him of his life's meaning, which was working with students. A university professor who went to school every day for 69 years until the pandemic, closed the university, and literally he had to be kicked off the campus. Throughout my father's life, whenever he engaged in some unhealthy behavior, I would often joke with him and say, "Hey, Dad, are you trying to die young?" And he would scoff back, "No, indeed." But it was during the pandemic that he wound up changing his response, which was, looks like I've missed that opportunity. Well, he left behind his 100-year-old wife, my mom. And even though I don't have the illnesses that put me at risk, like lung disease, I'm not immunocompromised, I'm not overweight, I do work in nursing homes and clinics where patients, staff, and friends have died. And so I wasn't willing to expose my mother or my patients who might be at risk to contracting the virus. So I did the research. I studied the methodology behind the development of the vaccines, and also gained respect for the head of the FDA, who almost lost his job because he wasn't being allowed to force through the approval of the vaccine unless he made sure it met FDA guidelines. Now, COVID-19 has wreaked havoc on all of our communities, particularly those of color. And it has robbed us of the life we knew before and replaced it with anxiety, depression, loss. And I just was not ready to let COVID continue to rob me of my life or the lives of those that I loved. So yes, I have gotten the vaccine. My mother has gotten the vaccine. And now both of us are looking forward to having that shared experience that my father had in terms of missing the opportunity to die young. And I invite others to do the same.
Thank you so much, Dr. Freeman. Appreciate your sharing your family's testimony with us. Next, Dr. Davis. What's your take on this?
Yeah, I agree with Dr. C. I think it's very important that we all get the vaccine. And like C, no, I don't have any other predispositions that will cause me to be hospitalized, but I've had a lot of family to die from COVID. And when people tell me COVID-19 is not political, yes, it is. My family who died from COVID are down south, where their governors told them they didn't have to wear masks. And because there wasn't a prevention strategy given for some folks, they got COVID and they died. And even worse than that, when someone went to the hospital, they were turned away. So they had to go home to die. So I think the vaccine is extremely important. It will not prevent us from getting COVID, but it'll prevent us from getting extremely ill from COVID. It'll prevent hospitalization, it'll prevent death. So I think it's extremely important that we think about doing it. I don't believe in telling people to do it. It has to be an individual decision. I don't want our people to be sheep and just do it because someone else said it. I want you to get all of the information and make a decision on your own, whether or not this vaccine is for you.
Thank you, Dr. Davis. So let's move to Dr. Jefferson. Dr. Jefferson, have you taken it or are you going to take the vaccine? Why or why not? We can't hear you, Dr. Jefferson. You're still muted.
Okay. Yeah, I have taken the vaccine. I mean, I've been practicing medicine for over 40 years now. I have never seen a case of measles. I've never seen a case of smallpox. I haven't seen a case of diphtheria, okay? And the reason or polio, and the reason I haven't seen any of those infectious diseases, vaccines, okay? These type of diseases have killed millions of people over the past 100 years. The only thing that stopped it was vaccines. Now, COVID, 1 year, February to February, has killed over 500,000 people. You know how many soldiers were killed in all of World War II? 450,000. This disease has killed more people than all of the soldiers who died in World War II. Now, this vaccine wasn't just created in a week or two. They didn't just throw some chemicals together to make it. These vaccines were studied. And like Dr. Davis said, 2 major studies, Moderna and the Pfizer. One thing you should know, each one of those studies had over 30,000 people in it. Each one, about 15,000 got the vaccine and about 15,000 got placebo. Now, it was 95% effective in preventing symptomatic disease, okay? Also, as important, with all 3 vaccines, there were no people who died from it, no hospitalizations, okay? They will protect you from dying from COVID. Now, I had COVID back in July, and I was in the hospital, okay? My daughter made me go to the ER, and I was admitted. And from what I understand, I was kind of out of my head too, but I don't remember that. But COVID can kill you. It will kill you. And the only thing that will prevent this disease is a vaccine. Now, I encourage all my patients to get it. You know, I give them the information, but at the end, I said, take the vaccine because you don't want to kill your family. We had a nurse just 2 weeks ago. All 9 members of her family who lived together got COVID. Now, as Dr. Davis mentioned, these new variants that's out there, they are much more contagious, much more communicable than the first variants that came out. Now, the vaccines look like it will protect you probably from the variants, but once you get a vaccine made, these messenger RNAs, it's not that hard to tweak it to be effective against the variants. So please, everybody, for the sake of your family, take the vaccine. Now, you talking about side effects? It was very few. You talking about 2%. Now, I'm an HIV doctor. One thing that we always did, we always looked at studies, okay? We looked at studies, we looked at primary endpoints, we looked at the C values, we looked at all of that. And these vaccines, it met its primary endpoints very, very easily, both vaccines. So, you know, if you really want to keep your family healthy and your community, and these death rates, if you want them to go down, vaccines, masks are good, washing your hands are good, but what's going to do it are vaccines. So please, everybody, get it and take your vaccines.
Thank you for sharing your testimony and insights, Dr. Jefferson. Again, reinforcing this is for informational purposes only. We want you all to make the best decision for you and your family, but having the testimony of these physicians is so powerful. And so I just thank you all for being so transparent about your thought processes. Is Dr. Obi with us? I think she may not have been able to make it. Dr. Obi, are you with us?
Oh, thank you, thank you.
If not, Dr. Obi was going to go next, but I'm going to move on to Dr. Bonner to ask you, have you taken the vaccine? Or are you going to take it, and why or why not?
Yes, ma'am. So first, I want to say thank you for having me. This is a really great opportunity to be here with some really great doctors. But yes, I have. I received Pfizer. My first dose was December 18th. I was the first person at my hospital who got it. There were three main reasons, three things that were important to me. The first one was the data. As everybody else said, we're scientists, the data was important. Most of my patients who asked me about the vaccine in November and early December, my response was, I don't know yet. And when the data came out from the FDA, when they first got the Pfizer vaccine, that first night I read those 54 pages. The same thing with Moderna. And that was important to me. I needed to know how many Black people were in the trials. I wanted to know what their response was, what the side effects were, the likelihood of seeing those. And I wanted to know if we were representative. We were a little over 9% of both of the Pfizer and Moderna original trials. And as far as adult Black people in America, we're about 10%. And so it was pretty representative of what I was going to see with my patients. I practice in the South. I'm internal medicine, primary care, and hospitalist. The second thing that was important to me was I want to see this end. I have taken care of people from the beginning of this in clinic, talking to people about wearing their masks. And I'm also the guy in the ICU that's putting a tube in them and putting them on the ventilator and signing their death certificates. So seeing the whole scope of this virus is heartbreaking. I lost more patients in the last year than I had lost in my entire career combined. I lost more patients in the month of January than I had ever lost in a whole year. Our hospital lost more in January than we had ever lost in a year. I have seen so much death that I want to be a part of the solution. And for me, the vaccine was that. And the third thing that was important for me, especially being a Black American from the South, was this is the first endemic or pandemic that I didn't have to wait for all the white people to get it first. We get to get this at the same time as everybody else. We didn't necessarily get that with smallpox and with some of the other things that have happened. And I want it to be first. I want it to be an example. I wanted my picture in the paper because I wanted other people to see me as an example. And I wanted my family to also be that. My 91-year-old grandmother has been vaccinated. Both of my parents have been vaccinated. My other grandmother in her late 70s has been vaccinated. I also wanted to see them. I hadn't seen my grandparents in a year until they were vaccinated because my greatest fear was getting my family sick. And so being able to be a part of how we get past this, how we get back to normal, and just being a part of the solution, all of that was really important to me.
Powerful, powerful. Thank you, Dr. Bonner, for your frontline work and just for being so transparent about the impact of with the virus on your patients, on your community. It's heartbreaking. Okay, Dr. Ajayi, we want to know, have you taken the vaccine or are you going to take it? Why or why not?
Thank you. And again, it's a pleasure to be here and to be part of this esteemed panelist. I agree with everything that my colleagues have said. And I did get the vaccine. And what you can't see, because you can't see the top or the bottom of me, but I am pregnant. And I actually received the vaccine when my first shot was when I was 32 weeks pregnant. I received it when I was on January 9th. I was 32 weeks pregnant. And like my colleagues here, initially when people were asking me, was I going to get it? I was very, very nervous and very hesitant. Like my colleague, Dr. Bonner, when the research came out, I spent that night and I poured through all the pages. I spoke to my friend who does clinical research with ACOG, and I thought about it. And I also thought about my own personal risk and the potential benefits that could be given to my child. For me, the ultimate decision, I went from, I'm not sure, to, well, maybe after I deliver, I'll get it as soon as after I deliver. And then by the time I went through everything, looked at the recommendations, looked at the data myself, I took the vaccine and I was very public about it as well. I wanted people to know, I wanted Black women to know, I wanted Black pregnant women to know that it's safe and it's okay to take the vaccine. The reason, aside from being Black and brown, being pregnant puts you at increased risk of some of the mortality and morbidity that you have. I can't imagine being pregnant and then having to see Dr. Bonner in the ICU and being intubated, because pregnant women who do have COVID are at higher risk of being intubated. They're more likely to be admitted to the ICU. Black and Hispanic women between the age of 33 to 44 have a 3 times more likely to die than their non-pregnant counterparts. So the risk of pregnant women getting COVID versus the minute reaction or minute chance of having a side effect from the vaccine is still so low. Additionally, like my colleagues here, so I'm a pediatrician, I get to see, I work in newborn nursery, I get to see that beautiful part of life being born. And then my other hat is adult palliative medicine. So I treat pain, and I also see a lot of patients in end-of-life care. So when my colleague is the one putting in his intubating patients, I'm there right with him when we have to transition those patients off life support. And where I practice, the hospital I practice adult palliative medicine in, having those conversations with my Black and brown patients, it's heartbreaking. Because the way it is right now, when your loved one dies in the hospital, you can't be there. You can't be there to hold their hands, especially if they're dying from COVID. It is a conversation that I never wanted to have with anybody. And to have these conversations with families who cannot physically be there to hold their loved one's hands. And I remember the first, we call it a compassionate extubation. Single man, 86-year-old Black man with his daughter there at the hospital. I was able to get them at least to let her into the hospital to see her dad from a glass screen. And that's how she got to say goodbye to him. And it was heartbreaking. And it's not something I would wish on anyone. So absolutely, I got the vaccine. I talk to my patients about it. I treat patients with sickle cell disease and help manage their pain. High risk population, and it's scary. But I give them my testimony. I share with them my story, and also share the data that we have. And yeah, I got the vaccine, and I encourage others to as well.
Thank you so much, Dr. Ajayi, and congratulations on being with child. So happy for you.
Thank you.
And for addressing this issue as someone who did take it with, being. So thank you so much. We're going to move into our Q&A now. And if you do have questions, please put them in the chat or use the Q&A function. And we have folks who are monitoring the Q&A function and the chat. And if you probably will see in the chat a link to a survey evaluation asking your input and feedback about the program. Please, 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 we want to get your feedback. And I am going to start with a few questions that we received from folks when they registered, and then we'll also take a few questions that come in during the course of the program. We want to give equal play to both of those sources of questions. So the first question, and panelists, just whoever would like to answer, you can just hop in. I just want this to be very conversational, and if Dr. Obi does join us, she can join us and help answer some of these questions as well. The first question is, Can I still catch COVID after being vaccinated? Does anybody want to take a stab at that one?
Yeah, I'll take that. Dr. Jefferson. Yeah, you could get COVID after being vaccinated. If you look at the studies, it's 90% effective. So about 5% of people can get COVID. Most important thing though, when you did get COVID, you didn't have to be hospitalized, you didn't have to be intubated, you're not going to die. So COVID will protect you from severe illness and it'll probably protect you from dying, but nothing is 100%. The most effective vaccine before this that I can remember was measles, and that was like 95% effective. So we haven't had a 95% effective until this one. So yeah, it's no guarantee you don't get COVID, but if you do, you won't die from it.
Thank you, Dr. Jefferson. The next, and if anybody wants to add something on to someone else's answer, you just use the raise hand feature and I'll make sure to incorporate you. Otherwise, I will go on to the next question, panelists. Someone asked, will we have to get the vaccine every year? If an annual vaccine is required, will it have to be the same vaccine every year?
I think the simplest answer is we don't know yet, right? So we're not sure how long the immunity lasts for the vaccine. We know that for the Pfizer and Moderna, we recommend the 2 shots 2 to 3 weeks apart. But as far as how long the immunity will last for, because the reason why you get the annual flu shot is based on seasonality and also how long the immunity gives you. So I think right now we just don't have the data to answer that definitively yet.
Thank you, Dr. Ajayi. Next question. Slight different variation from the question you just answered, Dr. Jefferson. Can a person who has received the vaccine transmit the virus to someone else? Dr. Freeman. Oh, you're still muted, Dr. Freeman.
The answer would be yes, but not from the vaccine. As the panelists have already discussed, that the vaccine is not 100% preventive in terms of you contracting the virus. And you could potentially have contracted the virus even before receiving the vaccine, and therefore you might transmit it. So that's why it's important that even after you've received the vaccine, to continue to maintain the recommendations regarding social distancing.
Thank you, Dr. Freeman. Dr. Jefferson, did you want to add something?
No, I think she kind of covered.
Okay. Thank you so much. And welcome, Dr. Obi. So glad you made it. We're so happy to have you. I introduced you to everyone, and we are in the midst of our Q&A. So I'm posing some questions and going to ask you to chime in as well to answer any of them that you'd like to answer. So welcome.
I don't have a completely white background. That's why my teeth look like that. They don't really look like that.
Okay. Thank you for the disclaimer. You're like, my teeth are pearly white. Okay, don't get it twisted. So glad to have you with us. So the next question is, are people with HIV at higher risk of getting severe illness from COVID? Dr. Jefferson, you want to take that one?
Yeah, are they at increased risk of getting severe COVID? We're not sure because the studies didn't look at HIV people in particular, but most of my patients with HIV are well controlled. They have their T cell counts in the normal range. For those people, I don't think they're at increased risk of dying from it. And so but we vaccinate everybody with HIV anyway, but we haven't gotten the data on that yet. But I don't think if they're under good control that they're at increased risk.
Okay, thank you, Dr. Jefferson.
Dr. Davis, what do you think?
Dr. Davis, I think he's asking you to chime in.
No, I agree with you, Ron. And they did include people with immune compromise in their studies, and they didn't find that there was any problem with getting the vaccine. I think that's the major thing. If you're immune compromised, you can still get this vaccine. So there's no reason not to get the vaccine, even if you have HIV and your CD4s are not, over 500, you can still get the vaccine.
Thank you both. Is the COVID vaccine free, like the flu vaccine, or will we each receive a surprise bill in the mail?
I'd like to answer that one. It is free. You will not get a surprise bill in the mail.
Right.
So, and that's the thing about it that's so good is that, you know, when we talk about health disparities, as I did earlier, we don't usually have access, but we have access to this. It doesn't matter if you have insurance or you don't have insurance, none of that matters. You go in, you get the vaccine, and there's no bill. No one's going to bill you for it. And that's the great thing about it.
Thank you. Thank you for that. Dr. Ajayi, I think this question would be good for you. If you are planning a pregnancy, but are not eligible to get the vaccine and won't be for a while, would you wait until after you are vaccinated to proceed with the pregnancy or move forward with the pregnancy and get the vaccine while pregnant? And that is a little bit of medical advice. I get it. So you don't, you can't give folks medical advice, but if you could just address the considerations that one should look at.
Absolutely. I will say first about planning the pregnancy. Pregnancies are going to happen whether you plan them or don't plan them. So if you want to have a baby, go ahead and start that process. As far as when to get the vaccine. So again, I spoke with my OBGYN. I spoke with people who work with ACOG, and I read the recommendations, and I read the data on both of the Pfizer and the Moderna vaccines. What I would say is, and this is my personal opinion based on talking to all these experts, I would get the vaccine. You have increased risk of providing immunity not only to yourself, but also to your baby. And I would, if you do get the vaccine, I'd actually wait until you're at least in your second trimester before you get the vaccine, because we know how tenuous the first trimester can be. Wait until you're in your second trimester and then go from there.
Thank you. Thank you. Next question is, should I get the vaccine if I've already had COVID?
Yes.
Yes.
If again, we're not telling folks what to do or not to do, but can you, anybody just kind of, what's the decision-making process, the things that folks should consider in making that decision?
When you get COVID, one thing that happens is that your immune system produces neutralizing antibodies. Now, these are supposed to protect you from another case of COVID, but everybody has different levels of antibodies. Some people produce high levels, some people low levels, some people barely any antibodies. So if you do have COVID, we think that for 90 days, you're probably protected against COVID, but you need to take the vaccine even if you've had COVID, okay? Because we thought at first you couldn't get COVID again, but it looks like you can now. So yeah, get the vaccine if you've had COVID. The only exception is though, if you had COVID and you were hospitalized, if Dr. Bonner gave you some neutralizing antibodies, or if you had convalescent plasma, then the recommendation is to wait 3 months. Otherwise, if you have COVID, get the vaccine.
Thank you. I was about to say that. Bamlanivimab or Regeneron are the two medicines he's referring to. But I would also add that the antibodies that you form from being vaccinated to the spike protein are a little different from the ones to the nucleoside capsid that you get from actually having the virus. So it's important to have those spike protein antibodies. So vaccination is important.
Thank you. Thank you. Next question. I am a senior, as in senior citizen, and I've been tutoring elementary students on Zoom. I'm scheduled to take a second shot next week. Is it safe for face-to-face contact if we wear masks and work outside with a barrier across the table? Or do I need to wait 2 weeks after my second dose?
Well.
Go ahead. Well, I had typed a response that, so the senior citizen may be protected against getting severe illness from the vaccine, but the students you're tutoring don't have any protection and they're still at high risk. And so I would say that if you do want to do in-person tutoring, absolutely do it outside, 100% do it with masks, have that 6 feet apart and have that barrier that will keep all of you safer. If you do want to do in-person was what I was gonna add, and I look forward to my colleagues for adding to that.
But I would wait till you got your second vaccine, because the first vaccine is probably, you got 50, maybe 60% protection. And the second vaccine is when you're gonna get up to 95%. Now you can wear a mask, you can wear a face shield, you can be 6 feet away and outside and still get COVID. I'm a living proof of that. I did all that and got COVID. So to be fully protected, to really protect her students and herself as much as possible, I would actually be err on the side of caution and wait until you're 2 weeks after the second vaccine.
And I agree with Dr. Jefferson, but I think we also should understand just because you get a vaccine does not mean that you no longer wash your hands, does not mean you no longer wear masks, and does not mean that you don't watch and make sure that you're 6 feet apart. Vaccine does not mean you forget all about those other prevention strategies. We have to still do that and get the vaccine.
What about Christmas?
Thank you. Anybody else want to chime in on that? If not, I will move to the next question. Can the vaccine change your DNA?
No.
Well, somebody asked, so I just need you to don't be mad at me.
The platform is messenger RNA. The messenger RNA, is you take a little piece of spike protein, you take the messenger RNA, like from that, when you inject it in someone, your body forms neutralizing antibodies against the spike protein. But the messenger RNA is in the cytoplasm. And as soon as the vaccine, as soon as you get that, it's going to disintegrate. And so it's not going to get into the nucleus. So if you don't get into the nucleus where your DNA is, you don't have to worry about it affecting your DNA.
I want to make sure that I drive that home. So this is a question that I've been asked a lot. I deal with a population that generally has a very low education level. And so just to put in perspective, think of the vaccine carrying squares and your DNA is a circle. The squares cannot cannot fit with circles, and circles cannot fit with squares. So the vaccine being a square cannot change your DNA, which is a circle. That's
great.
To put it simply.
Thank you for hopping in, Dr. Obi. Good to hear from you with those beautiful pearly white teeth. Thank you. Question, is it possible to get COVID-19 from the vaccine?
No.
No.
You want to elaborate on that, Dr. Bonner?
Oh, sure. No, it's not possible. There is no virus in this vaccine. The Pfizer and Moderna vaccines have 4 ingredients: mRNA, salt, fat, and sugar. That's it. The salt and sugar are just preservatives, and the lipid, the fat, helps it to get into the cell and do what it needs to do. There's nothing else in it. I did see one question where someone asked about mercury and aluminum and all the other stuff that people act like they care about. None of that is in there. I promise. I kind of joke around with my patients and say that this is a vegetarian vaccine. So gluten-free, all of that. The only, the sugar is PEG or polyethylene glycol, which is a lot like Miralax. And so as long as you're not allergic to Miralax, you should be fine.
That was the question about, somebody asked about egg allergy as well. So what Dr. Bonner also said, it addresses that.
Yes, thank you. Anybody else want to hop in on that one? Or go to the next question? Next question is, I'm a nurse and work in the hospital. Do you all think hospitals will eventually require employees to get the COVID vaccine?
I am the medical director for quality and patient safety for my hospital system. So my short answer is I hope so. The more complicated answer is probably not. The flu vaccine was on the market for 45 years before most hospital systems made it something that healthcare workers had to have. By the time there was, something that was required, we had the HIV data that Dr. Jefferson was referring to earlier. We had data in immunocompromised patients, cancer patients, those kind of things. There's still a lot of questions that we have with this vaccine. Those questions will really only apply to a very small, maybe 1% of the population, but they have to be answered before we can make something a true requirement for most hospital systems. So I say maybe, I hope so, but not for a long time.
And Dr. Bonner, even with the flu vaccine, isn't it right that some hospitals, so they'll do the flu vaccine survey, and then if you didn't get the flu vaccine, they'll make you wear a mask, or maybe they'll limit your patient interaction. So even now, we don't even mandate the flu vaccine within the hospital.
Yeah, ours does, but yeah, everyone's different.
Thank you all. Will you please describe again the similarities between the Pfizer and Moderna and how that is different from the J&J vaccine? Anybody?
Yep, Washington died because I'm about to be on TV in an hour.
Uh-oh, somebody's not muted. Who would like to take that one? Anybody describe the similarities and differences between the vaccines? I know Dr. Davis, you did that well in your presentation. I don't know if you want to take that one, or Dr. Obi, if you want to hop in since we haven't heard as much from you. I'm open.
Yeah, it doesn't matter. So Pfizer and Moderna, we pretty much have beat that horse. mRNA, salt, fat, sugar. Johnson & Johnson and AstraZeneca are a little different. They use an adenovirus vector. And so they use a virus vector to be able to get the genetic material into the cell to help you to make antibody to the spike protein as well. So the end result is pretty much the same. It's just the method of getting there. I kind of think of all these vaccines as just an engine, and we just found some different cars to stick that engine in. They're all trying to accomplish the same thing. As far as other differences, Pfizer and Moderna, the only real difference is dosage and how long it takes to get the second shot. As far as Johnson & Johnson, right now, that's a one-shot vaccine. There's research going on now about the efficacy with the second dose. And so it's likely that there'll be a second dose down the road for that vaccine. The Johnson & Johnson vaccine can be kept at regular refrigerator temperatures versus Pfizer having to be very cold and Moderna having to be pretty cold as well. So in my area in North Carolina, we're doing Pfizer in our urban areas where we have those sub-zero freezers and can, take care of that vaccine in that area, our Raleighs, our Charlottes, those kind of places. Moderna is more in some of our rural areas. And then I see a future where Johnson & Johnson is going to be one for outreach to places with, say, homeless people, very rural areas where we may not ever see those people again, or where there may be a long journey to get there and we don't have to keep it as cold. And so each of those vaccines will have their niche. But my recommendation to anybody on this call who is going to get the vaccine, get whichever one is available, because they're all better than not being vaccinated.
Absolutely. I was going to add to that. I know there are some concerns that right now J&J is only showing that it's 65% effective. It's still a lot, like Dr. Bonner said, still a lot better than getting COVID-19 itself. So if that's what's available to you and you only want one shot, go ahead and take it.
Thank you. Thank you. Our last question, someone wants to know, for those of you who have taken the vaccine, what made you comfortable with not knowing the long-term side effects?
I mean, how long is long term? You want to wait
Right.
5 years, 2 years, 3? What's long term?
Yeah.
What's
Well,
the side effects of any vaccine? We don't know. You take the vaccine, then I just don't understand people. What's the long term? You want us to wait how long? A year? You know what the long term effects of COVID is. Why do you have to have I don't understand what they mean by long term. Year, 6 months.
Yeah, I'm not the one who asked it. I just
Sure.
want you all to try and respond.
Well, I'll speak to that
I
too.
would,
Okay, let's do Dr. Freeman and then Dr. Obi. Go ahead, Dr. Freeman.
Well, again, Dr. Jefferson mentioned it. We know what the short term as well as we don't know all of the long term effects of the vaccine, but we certainly know what the short term and long term effects are of having contracted COVID. And there was a study that looked at people 6 months post hospitalization and the residual symptoms that they have. Number 1, fatigue. Number 2, sleep disturbance. Number 3, anxiety. And number 4, depression. And for the patient population that I deal with who already suffer with sleep disturbance, fatigue, anxiety, and depression, just to have that magnified by a disease, even if they manage to survive it, I would much rather take my chances with a vaccine that's gone through all the formal protocols than take chances in getting the disease, suffering from the disease, and the worst case scenario, giving it to someone I care for, or meaning my patients or someone I love, and having them die a premature death.
And one thing we know about this virus, it attaches to the endothelial cells of your blood vessels. And so every organ that gets blood, which is every organ, can be affected long-term from COVID. Particularly, we know there's some cardiovascular effects, myocarditis, coronary artery disease, heart attacks, and long-term neurocognitive defects. We know that that's can happen with COVID.
Thank you.
Sorry,
Dr. Obi, Dr. Guy, did 1 second?
Just to that point, I do want to mention, because I know we haven't talked about what people can experience with the second dose of the vaccine. And that, because I don't want people to be kind of caught blindsided by that. There are a lot of people who do launch a very strong immune response to the second dose of the vaccine, where you'll hear people saying that, oh, I got the fevers, I got chills and things like that. That doesn't mean that you got COVID from the vaccine. It means that your body recognizes the vaccine within your body and you launched an immune response, which is what you want to see. So that's why you will have that 24 to maybe 48 hours where you have that fatigue, fever, chills, and rigors, and still get the vaccine. We expect that to happen. That's your body launching that immune response. I just wanted to add that because we haven't talked about that yet.
No, I'm so glad you chimed in with that. Dr. Obi, did you want to share something? And then maybe Dr. Davis, I see you're off mute. Will you want to hop in?
Yes, so I just want to make sure that we do address the other side, which is to not vaccinate. As healthcare professionals, I think we have to be unbiased with the information. And so some people may have experienced previous vaccines and had adverse outcomes and may be afraid to experience another vaccine and have an adverse outcome. And some people do have long-term effects post-vaccinations. And so the reality is that maybe we need to answer those questions for those patients, especially for vaccines that have not been used with this specific type of biotechnology. So I think, so I get a similar question, do I need to be worried about, for example, if we don't know what happens long-term to the fetus, if we don't know what happens long-term to someone who has had multiple miscarriages, should we be concerned about that? Is that something that we should take into account? And as a physician, I think I have to address those fears because the reality is those kinds of outcomes do exist.
Thank you for sharing that. Dr. Davis, did you want to?
No, I didn't want to add anything, but I do agree that, that's why I said earlier, I don't want our people to be sheep. I want them to get all the information that they can get and then make a decision, an informed decision on whether or not they want to have the vaccine and which vaccine they want to have. And during my presentation, I know some people, even though we say the messenger RNA is not going to go into the nucleus and modify our DNA, that still may be a fear. Now they have another option. They can go get the Johnson & Johnson.
Well, you can't choose what vaccine you want. You have to get what's available. I don't know if you ever be able to choose which one you want. And as far as
you can say no, Ron, you can say no. They have the right to say no.
I know they do, but I guess when I talk to patients about the vaccine, at the end, I'm saying get it. I don't say you have the information, make up your mind. I'm saying not get it. Because do you want to die? You want to give it to your grandmother and she dies? You want to take it home to your family and they die? You want to take it home to your kids? Kids can get it. Kids can die, okay? You have this multi-system inflammatory syndrome that kids get. And we've had cases of that over where I am. So this virus is no joke. Sorry.
Dr. Jefferson, people are very passionate about this issue. I would just like to say, as we close this Q&A session, we are giving folks the tools in their toolkit to make an informed decision about this. And this vaccine is an important tool in the toolkit, and we know that. And
Ms.
so
Crawford.
Yes, Dr. Bonner.
Sorry, I do want to say one more thing on that topic because we kind of talked about the
1 second. I think Dr. Obi was trying to hop in before you, and then Dr. Barton. Is that right, Dr. Obi? I know she just hasn't had a chance to speak as much. Did you want to say something, Dr. Obi?
I know what's going to happen right now, but I'm going to say it anyway because there are people in the chat room that need to hear this as well. I am not getting the vaccine.
Who's not getting
I will, and I'm an emergency physician. I treat patients every day with COVID. In fact, I had 3 yesterday, one of which died. The reality is my life is also important. And I want to have children. Now, until somebody can tell me which vaccine to get, that will not have me have another miscarriage and wonder if it was related to the vaccine. And I do not. I am an educated woman. I went to medical school, I graduated with honors. I understand immunology, I understand reproductive health. I consider myself to be very healthy, and I'm not a conspiracy theorist. And like I said, I work directly with COVID patients. I myself have had COVID.
Thank you.
So for those of us who don't have enough information, who cannot lay it on the 5% death rate compared to unknown outcomes to the rest of our organs, to the rest of our system, I think it is necessary for us to not be villainized when we decide not to get vaccinated. I think it is also necessary to have some guarantees if we have other things in our life that will possibly be affected by the antibodies, by the immune response, the inflammatory response that comes both with COVID and with vaccines. And the reality is, for a woman who is trying to conceive, I need guarantees. That's it.
No, we
That's my
appreciate
story.
it.
Mhm.
We knew that was your perspective, and we invited you to come because we wanted to have a balanced discussion here. And thank you for being so transparent. I still think the point is it's a great tool in folks' toolkit, and we're just trying to get that information.
Right.
So, Dr. Bonner, you wanted to hop in and say something?
Yes. So I did want to speak to one point that we made about the mRNA and the technology. So I do want to make sure that for the general public that's listening, that we're pretty clear. mRNA is not new. This is the same technology we've been using in cancer research for decades, because the idea is if you can use mRNA to create proteins that look like cancer cells and make antibodies, you may be able to avoid chemo. And so that research has been going on. We've used mRNA to do Zika vaccines and so many other things that have been researched over the last couple decades. And so we know a lot of the long-term, at least 20-year data for how mRNA can affect people when we've used it in other things. And so that's one thing that I want to, and I'm so thankful for Dr. Obi for sharing her perspective and being really transparent. But I do have a question for you, not to put you on the spot, I'm sorry. But how do you balance the unknown of the vaccine with the unknown of the virus since you've had it? And if you were to have the vaccine and have possibly have issues with conceiving or delivering in the future, would you feel like it was the vaccine and not your previous COVID infection?
So I have to look at my demographic. The Black woman who exercises every day, who eats specific diet, who, when she gets sick, has minimal symptoms, but who has had vaccines before and has had significant symptoms. I also have to look at, I keep a diary of the way that my body reacts to everything. When I had the flu vaccine, for example, my menstrual cycle went on for 3 weeks. When I had the flu, nothing changed. I understand that my immune system is involved in both a response to an actual infection and to a manufactured vaccine. And in my case, I think it's significant that I had a 3-week menstrual cycle. Now, I had some other things going on at that time, but I've never had a cycle like that. So for me, my demographic, I work in the ER. When the nurses get their vaccines and they come in after the second vaccine, some of them with never had hypertension, that have elevated blood pressure, or are having some pretty significant inflammatory symptoms that are necessary part of taxing your immune system so that you can confer immunity. So in other words, you have to have these immune responses so that you can develop an immunity. Versus when I had coronavirus, for me and my demographic, I would rather not have the response that I've been seeing to the vaccine. And this is just the Moderna and Pfizer. I don't know about AstraZeneca and Johnson & Johnson, but just because it's a different engine and in the same vehicle, doesn't mean those little subtle things don't happen. And for those of us in my demographic, those subtle things do matter. Now, psychologically, I don't know if you've been through anything that causes PTSD, but miscarrying well into your second trimester is pretty traumatic. It is something that does not matter what the cause is. Thinking about that, if it happens again, you can't erase that. It's not erasable. It may be ridiculous, but it's just not erasable. And so everything that could possibly mount that kind of inflammatory response in me, I'm going to be very leery of. And if it happens and I conceive and it happens again, I cannot say that psychologically I will not blame that PTSD on the vaccine. I just can't say that I wouldn't, because it would be the only outlying thing in my life that I would have introduced. So because I've already had COVID, and a colleague of mine encouraged me to go get my antibodies drawn, which I think is a good idea. If I have antibodies, I'm not going to get the vaccine.
And I will say, and I wanted to jump in there and thank you again for your vulnerability and for being so open and honest. And I shared, I got the vaccine when I was 32 weeks pregnant, past I was in my third trimester when I got the vaccine. And it was, I said earlier, it was, well, maybe I'll wait until after I deliver the baby before I get the vaccine. And it went from, I'm not sure, to maybe I'll wait. And it is about looking at your own individual risk. Pregnant women were not included in the Pfizer trial. The Pfizer is the vaccine that I got, and it's looking at the data available to you. What I would say, just as a word of caution, so I think you and I have a lot of very similar stories in our demographic, Dr. Obi, and I would say that it's tough as a Black woman who is trying to have a baby, who's worked hard to have a baby and is currently pregnant. It's an intensely personal decision, and you shouldn't be shamed regardless of what you choose. I will caution against waiting till you have guarantees, because it is called the art of medicine for a reason.
Mm-hmm.
You would like to think that we are 100% certain in everything. We're not. It's the art of medicine. So it's using the information that's best available to you, and looking at what is out there. And I do research in maternal fetal health. Trust me, I'll be studying the effects of the vaccine, not only on the pregnant women, but also on the babies long term.
Mm-hmm.
My choice was based on my risk factors and my exposure within the hospitals and the patients that I take care of. And so it is intensely personal, and you have to look at kind of where you're coming from and where you hope to go. So I do appreciate you sharing your story as well.
Thank you. Thank you for sharing yours.
Yes, I am feeling the love all the way around. We have gone way over time, but this was so important to have this dialogue. And this is what family does. We have the conversations that we need to have. We love each other, and we want each other's best interests at heart. We keep each other's best interests at heart. And I just so appreciate everybody's transparency. Doctors, we thank you for just sharing your decision. Most of you all have either have taken the vaccine, one of you hasn't, and we appreciate all of you for sharing your insights today. We are going to have a couple things before we wrap up that I want to make sure that we have time for. The first is a reminder to complete the evaluation to those in the audience. It takes less than 30 seconds. And we are going to be spinning a wheel for some prizes for folks who are whose names we have in the wheel, and that will potentially win something. So don't leave. In the meanwhile, we want folks to take a poll again, please. We want to know, answering the same question, are you going to take the vaccine? Yes, no, or maybe. Please, we want to see where you wind up after this discussion. And I trust that this discussion has helped you really make an even more informed decision about whether to take the vaccine. And I'll just say, I, as a moderator, haven't taken it. I'm not eligible to take it yet, but I will be taking it. And I'll be rolling with the J&J for a variety of reasons. And I do have the ability to take the one that I would take also. So I want to, again, are you going to take the vaccine? Yes, no, or maybe? And hold on for our answers. 76%. So we're still about the same. We have a few more yeses. Maybe it's 1% higher, so that's good. And we still have a few folks that are saying no, definitely. So we are so appreciative for you taking the vaccine, that was prophetic, I think the vaccine, we're so appreciative for you actually taking the poll and letting us know what you're thinking. And I would like to, before we spin the wheel for prizes, Karen and Pavane are going to be doing that. I just want to, maybe let's do that first. Let's do the spin the wheel for prizes. Can we do that before I do my final thank you and then pass the baton to Katessa Charles? Karen and Pavane, are you able to do that?
Yes. Hello, everyone. Thanks to the panelists. That was awesome. I've taken the vaccination and I still learned a lot. But we're going to spin the wheel. We'll do 3 spins. Good luck to everyone out there. We're giving away Amazon gift cards. We really appreciate your participation. So Pavane, if you will do the first spin for us, and I will read off the winner.
Okay.
There's our first winner is bwhgj@gmail.com. bwhgj@gmail.com. Your Amazon gift card will be emailed to you. And our second spin. Our second winner, Donna.w@irmi.com. Congratulations. You will be receiving an Amazon gift card via email. Donna.w@irmi.com. And for our third, I think she's, yeah, there you are. Okay, and now to our third spin. Good luck, everybody. And our third winner this afternoon is Kay Norris at ucla.edu. Kay Norris at ucla.edu. Congratulations. Your Amazon gift card will be emailed to you. Again, thanks everyone for participating in our 3-series symposium. Hope you learned something. I know I did. And we just appreciate you and have a blessed day. Thanks.
Well, we're not done yet, but thank you so much for that, Sora Karen. I just wanted to, we're going to hear from Katessa Charles, who will close us out in a moment. And before I pass the baton to Katessa, I just wanted to close with a statement. You know, when I opened up, I said, welcome family. This really is about family, and we have to care about each other and love each other through this very difficult season. And I want to close with the words of legendary broadcaster and beloved elder Gary Bird, who's coined a term, an acronym, GBE. We close this show with that, and it stands for God bless everybody. So I just pray for each of you that you have good health and you make strong, sound decisions with respect to taking the vaccine and using the other tools in our toolkit to help protect us from COVID, the hand washing, the social distancing, the masking. We have to be vigilant. Our lives depend upon it. And God bless you all. And I pass the baton to Sora Katessa Charles, who will have the final word and send us on our way.
Thank you, Crystal. Thank you. I am Katessa Charles, a past board member and national officer of Alpha Kappa Alpha Sorority Incorporated, and a proud member of Theta Mu Omega. On behalf of the 130 members of Theta Mu Omega chapter located in Inglewood, California, I want to say thank you to our panelists for sharing insight, science, and stories that enhanced our understanding and perspective of the various vaccines used to combat COVID-19. We want to thank our moderator, Attorney Crystal Crawford, who did an excellent job of facilitating the program and keeping us engaged and on point. As you know, this was our third and final webinar in a series of webinars offering facts supported by science and expert opinions concerning the public health crisis of COVID-19. From studying our past with the Tuskegee syndrome presentation to deciphering between myth and fact about COVID-19, and now choosing to vaccinate today or delay, we have done our best to bring you the latest developments, the latest information, and expert medical opinions to enable you to make an informed decision regarding your personal health. I want to acknowledge and thank our partners, including the chapters of Alpha Kappa Alpha Sorority, specifically Alpha Alpha Nu Omega of Round Rock, Texas, Eta Pi Omega of El Paso, Texas, Mu Beta Omega of Inglewood, California, Omicron Eta Omega of St. Louis, Missouri, Sigma Pi Omega of Torrance, California, and the following organizations: ABIS, the Advancement of Blacks in Sports, the Association of Black Women Physicians in Los Angeles, Black Women Lawyers Association of Los Angeles Incorporated, the Charles R. Drew Medical Society in Los Angeles, the El Paso, Texas chapter of the NAACP, the St. Louis, Missouri chapter of the NAACP, the National Panhellenic Council in El Paso, Texas, the Links Incorporated in El Paso, Texas, Top Ladies of Distinction in El Paso, Texas, and Untouchable Academy in Los Angeles, California. Finally, for those who would like to view this series again or share it with friends and family, we will soon email everyone information as we plan to post this series on YouTube and Facebook by or before the end of March. You will have a chance to replay and refresh your knowledge on the facts and science related to COVID-19. We appreciate your attendance and look forward to the day when we can be in the same place at the same time to connect, embrace, and laugh again. Until that time, continue to stay healthy, stay informed, and stay safe. Be well.